Hello, myself Dr. Yogesh, Senior Orthopedic Consultant at Astor Whitefield Hospital, Bangalore. So today we are going to talk about the most common causes of shoulder pain in elderly age group above 60 years, say. So the most common reason in current days is frozen shoulder. Frozen shoulder is nothing but the shoulder gets stiff and more common in people who are diabetics, uncontrolled diabetes especially, and also people who have some trivial fall. There will not be any injuries, but because of the pain, persistent pain, shoulder goes into frozen situation. So we call it frozen shoulder or adhesive capsulitis or periarthritis shoulder. So there are many names for it. And the next common reason is rotator cuff tears. So unlike in adults, the patients don't need to have a fall for developing a rotator cuff tear because the muscles and the tendons are all degenerative. So even lifting a weight or trying to throw something, so the cuff might tear. They might hear a sound, give away sound in the shoulder, which indicates that there is a rotator cuff tear. So after that is the impingement syndrome. Impingement is because of the shoulder ball, the humerus, the ball of the head of the humerus impinges with the scapular blade. So it could be impinging with the bone itself or impinging with the bursal tissue. So the impingement is more common, which is more prominent in certain actions or positions of the shoulder. So these are the most common reasons, followed by again the referred pain from shoulder, the cervical disc prolapse. That pain might also radiate to the shoulder, which might give rise to shoulder pain, or the patient might present to us thinking it's a shoulder pathology. And arthritis. At last, we have arthritis. So degenerative osteoarthritis of the shoulder is also one of the most common reasons for shoulder pain. So how do we go about? Yes, definitely physical examination takes a priority. So we examine the patient clinically. Most of the times clinically we get to know what is the exact pathology, and if we are not sure of the pathology, definitely we can go ahead with radiographs and MRI scans of the shoulder to know what exactly the problem is. And if it is a very partial small tears of the rotator cuffs, or if it's a frozen shoulder, or if it is an impingement syndrome, definitely the physiotherapy is the main or the first line of treatment. So we start with physiotherapy. Then if the patient is not responding, then we think of other things. Like in case of frozen shoulder, we can think of manipulation under anesthesia or an arthroscopic capsular release. That's a surgery. It's a keyhole surgery, what we call arthroscopic capsular release. And if it comes to rotator cuff tears, again, there's a keyhole surgery for head arthroscopic rotator cuff repairs. If it's an impingement, definitely physiotherapy. If it doesn't work, then we go for debriding or decompressing the subacromial space arthroscopically once again. So we have various modalities